Today we'd like to talk a little bit about hepatitis C. This is the most prevalent blood-borne infection in the United States and the world. Particularly people that were born between the years of 1945 and 1965 are at risk, and it's recommended that all these folks get screened at least once to make sure that they were not exposed to the virus. This virus used to be called non-A, non-B when we first started studying it, and in 1991 interferon was approved as treatment. The interferon therapy was fairly demanding of patients, but more recently there have been many new developments in treatment which will make it simpler, easier, safer, and more effective. There still are some regimens that require using interferon today. The problem with the hepatitis C virus is that it has a high mutation rate, and therefore it can escape the treatments that we have. And many people thought that the virus could not be cured. However, with the therapy that we have now, cure is easily within reach for the majority of people with hepatitis C. The incidence in the United States is anywhere from 5.2 million to 7.1 million infected, making it significantly higher than the number with HIV. It's grossly under-recognized, and healthcare providers are not really looking for the disease. And so we have to look at where does it come from. It comes from blood, from people that have used injection needles, even as a teenager or many years ago. It may have come from people that used intranasal cocaine or had blood transfusions many years ago as well. And there are other sources that we're just beginning to understand. And the incidence of this disease has just decreased substantially since blood products were screened for hepatitis C, and also the public is more aware of the risk of transmission. Unfortunately, 75% of people are unaware that they're even infected with this disease. Still, intravenous drug use is the most common route of infection. It's rapidly acquired via needle sharing. And the prevalence is about 30% among intravenous drug users between the ages of 18 and 30 now, and up to 70 to 90% among older intravenous drug users. Now, who else might be at risk for hepatitis C? Those that have received clotting factor concentrate before 1987, blood products, body art such as tattoos and piercings, chronic hemodialysis, unprotected sex, sharing personal items that may have come in contact with blood like razor blades or even toothbrushes, being born to a hepatitis C infected mother, abnormal liver enzymes or needle stick injury, and being HIV positive. Some people get hepatitis C but have a self-limited infection, so not all those that have the hepatitis C antibody are positive for carrying the disease at that point. Now, how is it detected? Usually through an antibody test that's done as a blood test. The symptoms of the disease are non-specific, and people are rarely aware that they have the infection. It's usually detected only through screening programs. The antibody production is not detectable until about 8 to 12 weeks after an acute infection, although most of the people that we see in the clinic have a chronic infection for many years and they're going to be positive. Now, most people with hepatitis C have abnormal liver enzymes. The level of the enzymes doesn't necessarily reflect the activity of the disease, but a clinical assessment based on just looking at the lab values alone is very misleading. Hepatitis C is not a single organism. It is a range of viruses. It has multiple different genotypes. These do not really affect the prognosis of the disease, but they certainly affect the ability of the physicians to treat the disease and the type of therapy that we should be using. The natural history of the infection is that about 20 to 30% of people have some symptoms, and about 15% will clear the virus. Unfortunately, the remainder will go on to develop chronic hepatitis, and cirrhosis will develop after about 20 to 30 years in at least 10 to 20% of patients. Once cirrhosis develops, the survival rate at 5 years is 50%. And that's particularly worse when people get what we call decompensated liver disease, where they develop jaundice and fluid in the abdomen and other complications. They may also develop cancer of the liver called hepatocellular cancer at a rate of about 1 to 4% per year. Now, the factors that increase the risk of hepatitis C include alcohol consumption, obesity, metabolic syndrome, HIV, smoking, using marijuana, or having any type of chronic infection that may affect the liver in addition. Age, sex, race, and iron overload and genetic predisposition may also increase the risk of developing cirrhosis and hepatitis C. So the management of the disease is based on measuring the amount of fibrosis in the liver, and this can be done with liver biopsy or now with non-invasive blood tests or with special tests which may measure the amount of elasticity in the liver and tell you how much fibrosis is present. And once you have cirrhosis, you may have jaundice, which is yellowing of the eyes, fluid in the abdomen. You may develop bleeding, and survival once these things develop is about 18 months to 2 years. Now, there are other problems with hepatitis C, and these include developing lymphomas, developing complicated disease called cryoglobulinemia, where these cold reacting antibodies may accumulate in the body. You may get kidney disease with it, skin disease has been associated, diabetes mellitus, and a variety of autoimmune diseases from thyroid to rheumatoid disease, as well as multiple different types of neurologic problems and eye disorders. So it's important that if you are in the appropriate age range that you get screened for hepatitis C, that you ask your primary care doctor to do that, and if you are positive for the hepatitis C virus, that you have the infection confirmed, and once confirmed you get referred to an appropriate specialist who has experience in treating hepatitis C. Thank you, and we'll go on with further videos talking more about treatment.